planning. Instead of random sessions, I'm planning a series. Are you able to hear me very clearly now? This is without headset. So now I'm speaking without my headset. So is this very fine now? Or now I'm going to connect my headset and the microphone. So now I have connected my microphone. So that is option 1 and this is option 2. I don't know how you are able to perceive or hear which is better. The first one is better without headset or with the headset. Which is better, do you think? Yeah, Ria, send in direct message. Don't send personal message because every time you people send personal message, then again I have to change it too. Yeah, with this headset is better. Anita Pachigola. Very good, Anita. Yes. Right. My voice is like a tiger roaring, so definitely it will be audible. But which is better for you according to that? Yeah. Fine. So today we are live on the YouTube. We are going to start a web series. And this is OET speaking. And here we are. Yeah, till now I got only 2 names. One is Avil Kenwith and the second one is Carly Chelvi. What about the rest? That means you are not active participants or what? I don't know. If you want to participate actively and if you want me to correct your sentences, just type your name and your number. Yeah, Sukhwinder Kaur. Yeah, that's it. So otherwise I'll not call you. I'll not open your mic. You will not have any voice because I think that maybe you are busy with something else. You just are on duty or don't want to participate or you are busy with your children or family or eating. I don't know, no? So there are some students who say, sir, we are passively listening. We don't, because we are on duty, sir, we don't want to miss. So, but don't call us, sir, because we don't want to speak now like that. So here we have Sukhwinder Kaur. So number 3 is Sukhwinder Kaur. She is a nurse. And number 4 is Ria Kadarkutti. So only these students who give the names will be called for participation. Nurse. Number 5. Number 4, Ria Kadarkutti. Number 5, Anita Pachugola. She is a nurse. She is going for the exam. And yeah, exam going preference will be there. You will be given special sessions, personal sessions after the classes. So those who are going for exams, they can message me. Muthu Lakshmi, number 6. Muthu Lakshmi, nurse. Number 7 is Vinita Ramakrishnan. Vinita Ramakrishnan, nurse. Yeah. So we have got 7 names and we have got 8 on board. That means all are participating. Very good. That's very nice. Yeah. Today It is episode 1. Episode 1. Today is episode 1. Right. And we are going to have an introduction to the speaking subtest. Today's session is an introduction to the speaking subtest. So the beginning of beginnings, the commencement, okay, the what, how, why of speaking test. Yeah. First and foremost thing is we have to discuss, we have to know well in advance many different things. We must know well in advance many different things. We should know everything about speaking. What we should speak, what we should not speak, what is the modus operandi of speaking, which is the correct manner, what is your attitude to speak while speaking. Are you bossy? Are you parallel? Are you submissive? So what type of attitude? Are you trying to boast yourself? Boast about yourself? Or are you inclining towards the patient, giving him importance? What exactly is your style? That's what it is. The first thing is, number one, the first thing is the time management. The first one is the time management. Now, with regard to time management or regarding time management, now how much time do we have for the speaking test? Can anyone complete when you go into the speaking room? How much time do you have? Is it 3 minutes or 5 minutes or 8 minutes or 16 minutes or 20 minutes or 1 hour? How much time according to how many minutes? Can you please 8 minutes? The speaking test I asked, I'm sorry, you did not understand me. I'm talking about the speaking test. I'm talking about the speaking test, complete speaking test. Once you go into the room, how much time you will spend there? Yes, Ria Kadarkuti, Avil Narona. Yes, you are right. So, all of you, you can write like that. Okay, it is for 20 minutes. An ideal OET speaking test. An ideal OET speaking test lasts for 20 minutes. 20 minutes. It's the maximum time, not more than that. The maximum time a person can spend in the speaking room is 20 minutes, not more than that. Fine. It can be less, but not more, depending on your. Now, the first session, what is going to be the first session? All of you, passive, actively participate. What is going to be in the, yes. First, what will be there? Will there be warm-up session? Or will there be a role play session? Or will there be role play session 2? What exactly it is? What exactly is the session called as? Okay, what is the first session called as? I'm checking, will any one person write it properly? I'm checking. I challenge you. Even if one person can write it correctly, what session it is, I'll be very happy. What is the first session? Initially, what is the first session going on? So not even one person has written it correctly. No way. Not even one person has written correctly. So I am writing here. It is, this is the session. First one is warm-up session. Maybe some people will say, we also wrote, sir. There's a difference between what you wrote and what I wrote. If you can precisely notice that one, then you will know. I'll teach you number of things. These are called as compound words. Warm up. According to your knowledge, it is two words. It is two words. But according to me, it is one word. It's compound. Warm up. Warm up is not warm up. It's warm up session. Warm up session. Okay. Warm up session. Now, next question is, what are the other two sessions called as? Can you please type? What are the other two sessions? There are totally three sessions. First one is a warm up session. And what are the other two sessions termed as? There is a reason why I am asking. If you type, then you will know what I am telling you. So you will know how you are going to deal with these things. You are learning concepts here. So what are the other two sessions called as? What is the second session called as? What is the second session? First one is warm-up session. So second one is, yeah, come on, write down. What do you call the second one as? Okay. Even if one person will write rightly, correctly or not, I want to see. One person. I'm just checking out. You're all writing. But how many of you are writing it correctly? I want to see. What are these sessions called as? After the warm-up session, there are two sessions. What are these sessions called as? I told you already we are learning basics. Yes. So nobody has written till now correctly. No one has written correctly till now. What about the rest? You are doubtful. Okay, you don't want to write. That's fine. No problem. I am going to write it for you. These are called as role play session 1. Sir, we also wrote the same thing. You also wrote the same thing. What is the difference, sir? Yeah, check it out. Check it out. What is the difference? You will know that better. Role play session 1 and role play session 2. Role play is a compound word. They are not two separate words. They are compound words. We are learning about compound words here. Number of compound words we'll be learning in the in the process. So role play session 1 and role play session 2. Now, the next question is, how many minutes does the warm-up session last? So, how many minutes? What is the duration? What is the duration of the warm-up session? What is the duration of the warm-up session? What is the exact duration of the warm-up session? Participate, please. What is the exact duration of the warm-up session? Yeah. Yes. Many people, after so much practice, we don't know how much time we are spending for warm-up session. The warm-up session lasts for 4 minutes. It's 4 minutes. If you are not using the warm-up session for 4 minutes, that means you are not mentally ready for the speaking session. It is not mentally ready for the speaking session. Why are they giving warm-up session? So that you can, become friends with the interlocutor. You can make some rapport with him. You can build up some chemistry with him. Okay, you can be free and you will not fret. You will not be anxious. You will not be tensed or worried. So that first 4 minutes you will be um, getting in tune with the interlocutor. Otherwise, if directly the questions are asked, you will not be ready to answer. So that's why you are given a chance to speak with the interlocutor, to understand his vocabulary, to understand his way of presentation, to understand his style, to understand his speaking manner, to understand his tone, all these things, to have an idea, so that you will be acquainted and ready when the role play session starts. Okay. Now we understand that role play session lasts for 4 minutes. And what is this role play session assessed? Is this, sorry, is this warm up? Is this warm up session assessed? Yeah, my question is this role play session, is this warm up session assessed? Is it a yes or a no? Is this warm up session assessed? Yes, that's good. One by one, respond, please. You should respond. Otherwise, there is no meaning in this session. Okay, a lot of things we are going to learn. Is this warm up session assessed? Yes or no? Okay. If it is not assessed, okay. So many students have said that it is not assessed. Okay. Kalai Chelvi says ho. I don't know what is this. Oh, okay. I'm joking. I'm joking. Okay. All right. So it is not assessed. Then what, if it is not assessed, then what is the purpose of this warm up? What is the purpose of this warm up session? Yes. If the warm up session is not assessed, then what is the purpose of this warm up session? There is no assessment. They'll not give you any marks for this. Then why? What is the purpose of this warm up session? Okay, you'll know. Yes, to get used to each other's voices. Yeah, that's why. Very good. Anita Pachugola. Very good. That's really good. Come on, what else? Come on, you can write more points. You can write more points. So all of you know that very clearly, and you know that they are not assessed. This is a warm up session. Warm up session is not assessed. Then why should they ask these questions? Why should they conduct this session? 4 minutes of waste, nah? If it is not assessed, do you think? Then I don't know. I'm new to this OET. I don't know anything. I'm a nurse or I'm a doctor, and I'm just asking you. So you should guide me now. If this warm up session is not assessed, then why should they waste 4 minutes? What is the purpose behind this warm up session? Yeah, Kalai Chelvi says, alleviate the stress. Yeah, many students suddenly come into the hall. Yeah, come on, all of you, answer please. Many students, you come into the examination hall and suddenly you see the interlocutor, and you see him that you see that he or she, the interlocutor, is from some other country or some other state or some other nationality or maybe some other gender other than if you are a male candidate, it may be a female or female nurse, then male interlocutor. It may be anything. Maybe you feel that you are comfortable, ladies will be feeling that ladies are comfortable with the ladies, and men feel that men are comfortable with men, and some men are comfortable with ladies, okay, and some females or ladies are comfortable with males. This is thinking styles. Many people think like that. Do you think that okay, come on, is there any value in, is there any meaning or is there any essence in what I'm speaking? Okay. So then that particular time you feel that, oh, last time a lady was taking my speaking session, she was smiling, it was very nice, and then now there is a gentleman, I don't know how to talk, I'm not able to open my mouth, I don't know how I'm going to speak, what will I do now, if I get stuck? Yeah, he's not smiling, he's little serious. All these things, many things come into point here, come to play in this role warm up and role play. Yeah, I will say, sir, to gain confidence. So when you speak with the other person, yeah, okay. Oh, he's friendly, he's answering me, I'm able to understand his pronunciation, I'm able to understand what he's speaking, I'm able to clearly able to understand his pronunciation patterns, his style. Next one is mental stability. Sajida Tabasum. It's not mentally stability, mentally stable or mental stability. Okay. So mental stability. That is what you have to write. Write again. Mental stability. Okay. So what do you mean by this? Gain confidence. Gain confidence. Okay. Now he's speaking. He's asking me some questions. I'm able to understand, and I'm able to give him answers. In general answers, I'm able to give. So if I'm able to understand his questions now, in the role play also, I can also understand his pronunciation. I'm able to give answers to him in the warm up session. So in the role play also, I can give the answers to him. So there is no problem. I can face him in the role play. So you have some. Vision about how you are going to do the role play, how his pronunciation will be in the role play, how he will respond in the role play, whether you can answer his questions or not. So you will gauge the quality of his pronunciation. You will be able to understand whether he's friendly or not, or how to deal with him in these 4 minutes. If you can manage, that means in the role play also you can manage 5 minutes in the first role play and 5 minutes in the second role play. So you'll get that confidence level. You can boost up your spirits, and you say, if I can manage well in this warm up session, definitely I can manage in the role play sessions. That is what is the confidence you'll get. The next one, mental stability. Now suddenly you enter into the room as if you feel that you are in a lion's den or cage, tiger's cage or lion's den, or you are in front of a tiger or a cheetah or a leopard. Then how you feel? Okay, how you feel? That's what it is. Now, when you see that this lion, after spending 4 minutes, and this lion is not attacking you, that means you can go and you can go and touch it, no problem. Try to understand this one here. So the way, even a tiger, if you are in front of a tiger, if you are in front of a tiger and a tiger doesn't pounce on you, a tiger doesn't attack you and doesn't beat you, or tiger doesn't scratch you, or a tiger doesn't roar at you, then now for 4 minutes you are stable. That means you will be talking, hello, how are you, to the tiger, or you'll go and touch the tiger and still the tiger is not doing anything. Then that means you can spend another 1 hour also with it. That is what I'm telling you here. You are visualizing a tiger in front of you. You are visualizing a cruel animal in front of you. You are visualizing some danger in front of you. That is the reason why you are feeling anxious. That is the reason why you are feeling tensed. Okay, you are started fretting. You're panicking, sweating. So why all these things? Now, in these 4 minutes, you can settle down. In these 4 minutes you can relax. You can, these 4 minutes you can maintain your calm. It's like a meditation or yoga, or it's a prayer before you start the day. That is how it is. It will definitely help you. No, Swati, they will not record the warm up session. They'll just make you to friendly. They're not assessed, so why should they record? It's a waste of time. That's it. Next one. Yeah, Swati is asking some questions. Dr. Swati Nemade. She's asking some questions. Sir, are they recording the warm-up sessions also during the exam? No. Swati, the answer is a nay, a negative, because they will not record your warm-up sessions because it doesn't add any value. Okay, so they're not going to give marks to that one. Okay, this warm up session is only to make you relaxed. So the purpose of this warm up questions or warm up session is only to make you feel comfortable, relaxed and cool. Once you are cool, then you can start with the role play. That is why they want you to be relaxed, otherwise everyone will lose the exam. That's the point. So the next one, because I have heard that while rechecking or in case of borderline marks for passing, sometimes they assess the stock also for giving marks. Yes, what your doubts are genuine. Your doubts are genuine. People talk 100 different things. People talk 100 different things. You only listen to people. That's why you are asking these questions. So if you go to the OET booklet or if you go to the website, then it is very clearly. You just ask in the website, are the warm-up sessions assessed? No. The answer is a very clear-cut big no. They will not be assessed. So what are you supposed to do? You speak naturally. You make friends with him. That's all. So whatever the situation is, warm-up session is not recorded. Number one, warm-up session is not assessed. Okay. Warm-up session is not assessed. That's very clear. A big no. Right. If you want to see later, I will show you those things. And warm-up session is not assessed. You can see the official booklet. Go to the speaking session, and there you can see warm-up session. Will it be assessed or not assessed? Speaking session. Yeah. Warm-up sessions, preparation tips. Yeah. This is a teacher's book. I'll show you. Speaking. Yeah, speaking is in the second part. Okay. So warm-up session is not assessed. Okay. And it will not be recorded. That's it. The next one, because I have heard, you have heard some people say nonsense things. Some people say OET is making money. Some people say OET is cheating. Some people say they just want to loot our money. Are these true? It's a big no. There is a saying in our language, Andani Draksha Pullana. That means the grapes which are not accessible are sour. Okay. The grapes which are not accessible are sour. There is a fox. It goes to a forest. It sees a vineyard. Then there grapes are there. So grapes. Okay. So this fox tries to jump to catch those grapes. It's a story in the kindergarten. It's a story in the school books, English story, in the Chandamama or some other story books. Okay. So comics and other things. So this fox jumps at the grapes. It cannot reach. It cannot reach. It tries. It gets vexed and say, these grapes are sour. I don't want them. Like that one. So people are like that. People are crazy. They have, you know, a flexible tongue. They have flexible tongue. Their tongue lashes at anything else. Instead of finding their own weaknesses, they want to blame somebody else. That's all. For example, like a small child, okay, father asks him to get up at 6 o'clock. He doesn't get up at 6 o'clock. He gets up at 7 o'clock and he says, father always disturbs my sleep. So, blame game. People who cannot succeed, they blame the others. This is natural. My brother is not good. My father is not good. My mother, my brother, my sister, my friend. My friends are not helping me. So, like this, they always blame. Oh, yeah, that's it. So, people are there like that. So, don't trust people, trust OET. Okay? Trust OET because ultimately it's final authority and OET does not want your money. OET is a social organization, welfare organization, very big organization. Okay? It is providing employment to number of people and it is providing opportunities for others to go abroad and study. So definitely it is the best. A person, if you look at the sky and spit, you look at the sky straight forward and spit, the spittle will fall on your face only. It will not reach the sky. OET is a sky. So don't try to spit at the sky. Don't try to blame OET because everyone can understand very clearly that you are blaming OET because you are such. So don't blame OET, please. There may be one or two negative people in the organization, because every organization comprises of good and bad. Maybe one or two greedy people may be there, so they may be doing some nasty things. It doesn't mean that, okay? So this doesn't happen, right? So next, I can give you a parable here. If you take one, you have two chocolates, okay? You have two chocolates, and you have 10 friends. What you will do? One friend comes to your house, and that time you remember that you have a chocolate. You take one chocolate and you give your friend another chocolate. Now, what happens? Then, what happens? This friend goes and tells all the other friends, see, Simon gave me a chocolate. Then all the others will ask, why you did not give us? Why you gave her? That means he is your. So, like this, try to understand the point. When one thing good is happening, nine people will tell bad. So that is different story. We all are aware of these things. Okay, good is always good. How much dirt you throw at it, good is always good. That's it. Okay. Now, good people will always be good. There are some foolish people, There are some foolish people. What they do, they know that it is wrong to give some money to take question papers or leaked papers or something. There are some of my own students. I told them, no, no, don't do that. These fellows, they went and gave their money, maybe 70,000, 80,000, 15,000 first, then 10,000, then 15,000. Then they started asking 1 lakh like that. So they're going, money is going on, going on. Then afterwards they said, okay, we cannot do anything more. So they stopped. Then that time they come to me and they'll tell me, sir, I paid like this, sir. I told you don't. Then why did you do like that? Okay. They started blackmailing. They said, we'll uh, send you to court or something like that. Cheating, blaming. Okay. So then I said, don't do that. Okay. If these people, these stupid people, what they don't know? Are they not doctors and nurses and other professionals? Are they immature? Are they not wise enough? Then what should we call these stupid people? Giving money, leaked papers, is many people are working hard and getting, these people who want to, then afterwards crying. Don't we call them, should we not call them foolish people? Then what should we call them? Wise people? They lack common sense. They don't know that it is not good. Did their parents not teach them what is quality? Did their teachers not teach what is quality? Does their conscience say, does their conscience not say it is not correct? Then why still they are doing? Then what term can we use for them? Should we call them wise or foolish? It is called idiocy. Idiocy. Okay. It's not helplessness. It is idiocy. Knowingly doing something wrong is called idiocy. That's it. When you know that something is wrong, never dare to do that one. Right. Next one. So I think you got your answers cleared. Dr. Swati Nemade, I'm unmuting you. Yeah. Dr. Swati Nemade, are your answers, are your questions answered? Okay. You can unmute and speak, otherwise you can just type there. Okay. So I have heard that while rechecking, or in case of borderline marks for passing, sometimes they assess this talk also for giving marks. Absolutely, at loggerheads, there is no way warm-up session is assessed. That's it. Okay, thank you, sir, for clarification. Next one. But, sir, my senior tells me about this warm-up question is recorded. It may be recorded or not recorded. They may record. maybe discipline purpose, but this recording only for that center. Okay, misbehavior or something like that, maybe. Okay, people said a lot of things, maybe, may not. Okay, maybe, may not. Right. So next, that's very clear. Next, now the next question is, we know that it is for 4 minutes. Now, can you, so those who have attended warm-up session earlier, okay, can you type some warm-up questions? Can you type some warm-up questions? Okay, can you type some warm-up questions? Right. Can you please type some warm-up questions? One by one. Why did you choose nursing? Maybe you will be typing something wrong, so that's why I'm telling you. So maybe I can correct you. Why did you choose nursing? Correct sentence. Why did you choose nursing? That's question number 1. Okay. Why did you choose OET? Why did you choose OET? Simran, you have to write capital letters. Yeah, I told you already. Discipline purpose, they will do everything. The complete session. It's not like recording everything. Okay. They will take only the this one. From the beginning to the ending, 20 minutes, they continuously record and they will take only the warm-up sessions. Because they cannot stop, start, stop, start. So continuously 20 seconds they can record and then leave it off. That's all. Because every time they cannot start, stop, no? So that's why they may record like that. Different situation, different scenarios. That's not a problem. Yeah. Next. So why did you choose OET? That is the second question. Sir, they are recording all the things. Immediately we enter the room for a discipline purpose. They inform that before they start to record in Sri Lanka. Okay. Different places, different things. They may record, they may not record, whatever it is. Okay. Who is your role model? Yeah. What challenges do you face working as a critical nurse? Question mark. Anita, question mark. What are the challenges that you face? What challenges do you face? That's also correct. Okay. Who is your role model, right? Tell me about your profession. No question, Simran. Tell me about your profession, full stop. What is your advice for junior doctors? What is your advice for junior doctors? Question mark. Kalai. Question mark. Come on, write down some questions, because these questions only everyone will write and submit afterwards. All these questions everyone will write and submit. Yeah, these are the questions. We'll collect all the questions. Yes. Can you please tell me something about yourself? Very good. Come on, come on. We're moving forward. Some more questions, please. What about your specialty? What about your specialty? What about your specialty? I'm not clarif. I need some more clarification. Can you ask the question more clearly? What is your specialization in medicine, or what is your specialization in nursing? Are you asking that one? Or what are your special qualities? Are you asking that one? Clearly, Kalai. a little bit clearly. What, why you are select, why you are select a specialty in, yeah, uh, why you selected a specialty in medicine? Still not clear. What is your specialization in medicine? Or why did you select cardiology in medicine? Or like that? Why did you select a specialty in medicine? No, that's not very clear still. What makes a good nurse, right? What makes a good nurse, right? All of you will take down all these questions. I'll be posting in Telegram channel. You will take all these questions and write all your answers. Okay. What makes a good nurse? Very good. Come on, come on. Yeah. What are the recent trends in nursing? Very good. That's a good question. That's an awesome question. So these questions we'll deal before we start the role play. In the warm up, we'll take one session for warm up session. You can note down all these questions and keep them with you. And those questions we'll send to everyone and we'll discuss those. Who is your role model in nursing? That's absolutely right question. What are the recent trends in nursing? Very good, right question. There is no mistake, not even a single mistake. So you can write these questions. Uh, Ria Kadar Kutti, you can write all these questions and send me. Make a list of all these questions. Okay, all these questions. So two people. I will also will write, and Ria also will write questions suitable for nursing. And what are the questions suitable for the medicine? Kalai will write. Swati will write. You can prepare your own questions for them. I'll give you more questions. Right. Thank you, Ria. Can you please tell me your routine at the hospital? Can you please tell me your routine at the hospital? Can you please tell me your routine at the hospital? So this is for you applicable for both nurses and doctors. Some questions specifically for doctors. Dr. Kala asked that. That's specifically for doctor. You can change that one for nursing also. What is your specialization in nursing? Okay, ICU or aged care? Yeah, come on. Now we are moving forward. So this speaking test, this speaking subtest is a profession specific test. That means nurses will have different type of role plays wherein they have to enact the role play of a nurse, and doctors have specific medicine related role play cards, and they have to play the role of a doctor with a patient or a caregiver. So they are profession specific tests. A physiotherapist will have his own, a pharmacist will have different set of cards. So it's not common. Doctor will pretend to be a doctor, nurse will be like a nurse, and physiotherapy or pharmacist they will do the role plays related to their profession only. So doctors don't participate in the role play cards of nurses. Nurses no need to play participate in the role play card of doctors. But grammar, vocabulary, pronunciation, all are same. You can listen to them and take some sentences, styles, and other things, and you can use them. For example, the doctors will say, I prescribe insulin injections. Doctors will say. But nurses will say, the doctor has prescribed insulin injections. So that's the difference. Otherwise, everything is the same. Otherwise, everything is the same. Yeah. Next one. Which country you are planning to move? Move from where to where? Are you moving USA to UK, or are you moving UK to USA? Huh? For example, I am moving this mouse from my palm to the fingers. Which country you are planning to move? You are not moving any country, you are moving to a particular country. So you have to say, which country are you planning to move to? Move to. You planning to move to. You're planning to move, or you're planning to move to. So to is missing there. And you, which country you are, which country you are planning to move. You are planning to move is not question. Are you planning to move? So to which country? To which country? That is the right answer question style. To which country are you planning to move? Simran, correct the question. To which country? Yeah, I'll correct your sentence. Yeah. So the correct sentence is like this. To which country are you sorry. To which country are you planning to move? I told you, no? I told you already. You'll be doing many mistakes like this one. Okay. So you'll be doing mistakes like this. So you have to be very careful. To which country? If you are going to ask patients questions, then you are going to do me. Okay. Right? You'll do mistakes. To which university are you planning to enroll? In which university are you planning to enroll? In which university are you planning to enroll? Take admission in. So in which next question is, yeah. To which country are you planning to move? Which is your next destination? Question mark. W capital letter. What is the most challenging part of nursing? Very good. Good question. Can you describe your job? Can you describe your job? Yeah, fine. That's enough. Next one. So you are required to complete 2 role plays. You are required to complete 2 role plays. And these are the 2 role plays based on ideal workplace situation. Workplace situation. That means, as a nurse, how you deal with your patients or their relatives or their carers. The same thing you are going to do. Real nursing job, hands-on practice, what you are doing, the same thing is going to happen here also. You are going to do the same thing here also. Remember that. Typical workplace situations. Now here, now coming to the 2 role plays. It's the same. First role play 1 and then second role play next. So 2 role play sessions you are going to do. Now, each role play is divided into 2 parts. Each role play is divided. So 20 minutes is the actual time. Now 4 minutes gone for warm-up session. Now how much time is remaining? 16 minutes remaining. 16 minutes remaining for the actual session. 16 minutes remaining. So 16 divided by 2. That means each role play lasts for 8 minutes. Each role play lasts for 8 minutes. Now that's very clear here. 8 minutes one role play, 8 minutes second role play. Now This time of 8 minutes is divided into two parts. Actual role play session and pre-role play session. That is, first one is preparation time. Now, preparation time. According to your knowledge, as far as your knowledge permits, you tell me how much time is there for preparation? Active participation, please. We are going to do a lot of practice like this. If you are ready to listen like this, I'll give you more and more of this. Speaking, listening, writing, direct, interactive. So, 3 minutes. That's fine. 3 minutes. In the role play session, we'll discuss what we should do in preparation time. Okay. Now, presentation time. Now, presentation time. How much? 3 minutes gone. So, how much time can you spend for presentation? Yeah. So now, so finished. Right. So we have 3 minutes for preparation and 5 minutes for presentation. Preparation time and presentation time. Okay, fine. Right. Till then, so far, so good. Now let us go to the next one. Now, in each role play, you are expected to demonstrate proficient communication skills. Communication skills. What are different types of communication skills? We'll discuss later. So, you have to present proficient communicative skills that are relevant to your specific profession. Okay? Relevant to your specific profession. That's it. Now, for example, if in the role play, the patient asks a nurse, my daughter is suffering. She went into the garden and she was playing and she had difficulty breathing and she was wheezing. Now, that's the reason why I brought to you. She is suffering a lot 1 hour. Now it is little better. I think that she has asthma. You know, my husband has asthma. My husband had asthma, childhood asthma. When he was child, he had asthma. And these are the symptoms. So because she has these symptoms, and because my husband has asthma, I think she has asthma. Now you confirm and tell me that she has asthma. Check now, you check with whatever you want, assess her and tell that she has asthma. Now nurse should understand, is she permitted to speak that she has asthma? Does she have the authority to declare that this child has asthma? Yeah, respond, na, please. I'm waiting for your responses. So, does the the mother is asking, my child is suffering, I want to confirm, I know that these are the symptoms of asthma. That's very clear, because my husband told me when we were talking, he told me that he had asthma when he was a child. Even today morning also he told that he exhibited the same symptoms when he was a child. So maybe it is like that, he told. So now I know that these are the symptoms related to asthma. The signs and symptoms suggest that they maybe asthma. And my husband also had asthma when he was a child. So I believe that my daughter has asthma. Now what you have to do, you check, you assess, do some test or something and tell that, yeah, she has asthma. Is the nurse authorized to declare or diagnose, or can she diagnose? Definitely no. So that means you have to act as a nurse and not as a doctor. It's the doctor's duty to assess, to declare, to prescribe. So you cannot step into the role of a doctor and do the doctor's job. Who has given you authority to tell that these symptoms? Okay. You cannot, and you should not. If you respond positively to the patient's mother, that means you are in a slippery ground. You will slip down. You will not get a good bands. You will not get good bands, or you will not get a good band. So be careful. Mind your business. You are a nurse. Behave like a nurse. Don't try to behave or superpose yourself as a doctor. Then you have to tell them your concerns are genuine, extremely reasonable. But let me give you some information which is very important for your knowledge. I am a nurse and I am not authorized. The doctor is the concerned person who is authorized. You need not say, I am not authorized. You can say, I am a nurse. What I can do for you is, I will pass on all the information that you have provided to the doctor, or you yourself can talk to the doctor and tell all your points. Then, because the doctor is the authorized person, he will do the relevant tests, he will examine the condition, he will assess, evaluate, and if necessary, he will ask for some tests like blood test, urine test, or some other test. And based on those reports, the doctor will confirm whether it is asthma or not. If it is not asthma, you will get some relief because he will declare the same. If it is not revealed in the tests, then he may ask for some other additional tests to double check or cross check before giving the decision. If the test reveal the symptoms, if it is positive, then he will diagnose the condition and then prescribe the medications and suggest the necessary measures. So this is the way how you have to talk if you are a nurse. Then if you are a doctor, how are you going to talk the same? The doctor will say like this, doctor, I know, doctor, my daughter has asthma. I'm sure. I'm sure. I'm pretty sure my daughter has asthma because, the symptoms I have seen. The signs and symptoms show that, okay, based on the signs and symptoms, I think it is asthma, doctor. I'm sure, 100% sure. My husband also had asthma when he was a child. So if you could consider these two things, my daughter has asthma too. I'm upset, doctor. So can you please tell me, doctor? Your concerns are genuine. Your worry is absolutely reasonable. Your expectation or your analysis of the situation can be partially, okay, true, maybe true, or maybe false. There is equal possibility. You may be right, you may be wrong. No one can ever know. You're just telling based on your perception. Perceptions may go wrong. That is one side of the story. So now, what I'll suggest you is, I will order some tests for you. Go to the laboratory and follow it up. The reports will reach me tomorrow, so we can discuss and confirm, or the results may come within half an hour. I cannot tell you that she has asthma right now because I'm not sure. I need solid proof. I need the confirmation. Then only I can tell you. If I'm not sure, then how can I tell you? I should see some solid proof. So that is the reason why I will order some tests. And if the test results are positive for this condition, that means your daughter has asthma. Otherwise, it may be something else. Now, first we should get clear whether these symptoms are those symptoms related to asthma or not. Only after receiving the results of the laboratory tests, I can confirm asthma if your daughter has, or rule out asthma if the test reports are negative. All these sentences are there on the YouTube. I should have given to artificial intelligence. I forgot. It will type our lecture and print a book. I forgot. It's okay. So, these sentences you can use. They're coming naturally. Though I am a doctor, my power is limited. Just by seeing your daughter, just by physical examination, I cannot confirm or rule out asthma. Neither I can confirm nor rule out. I can neither confirm nor rule out asthma. Based on physical examination, I can neither confirm nor rule out asthma. Take this sentence. What all sentences I am using? You can use. I told you in the beginning of the session. One sentence. Two students submitted their names. One is Avil Kenwith and second one is Kalai Chelvi Guruparan. Two students submitted their names in the beginning. Two students submitted their names in the beginning. Colon. The former two students dash Avil Kenwith and Kalai Chelvi Guruparvan hyphen or dash submitted their names in the beginning when I asked them for attendance. Colon. The former is a nurse, whereas the latter is a doctor. The former means the first person, the latter means the next person. Learn these styles. I am prescribing 2 medications. Kalai, unmute. Can you? I have some questions to ask. Because you can answer these questions. Or Kalai. 1,
Yes,
2,
sir.
3. Yeah, unmuted. Very good. Immediately unmute, okay? If you are comfortable, you can open your video. Otherwise, no need. So now I'm asking you the questions. Now, very good. Thank you. I'm asking you some questions. Diabetes and hypertension. I am a patient. I have diabetes. I came to you and you diagnosed for the first time. I have diabetes and I have hypertension. Now, what medication will you prescribe for diabetes? And what medication will you prescribe for hypertension? Both same time you diagnosed. Now tell me, for medication, what is the medication you will prescribe me for diabetes?
Metformin.
So you will prescribe metformin for diabetes. Next, what is the medication that you will prescribe for hypertension?
Nifedipine.
Can you please type there or can you spell it please? So metformin.
Yes.
Metformin for diabetes. Metformin for
MET.
diabetes. That spelling I wrote. Metformin, diabetes. Okay. The next one is
NIFI.
nifedipine.
Yes.
NIFI.
DIPINE. DEPINE.
DEPINE. Okay. Nifedipine. Okay. This is for hypertension.
Yes.
Now, I gave you an example using your name and Avil Kenwith's name. In the beginning of the session, or at the beginning of the session, I asked those who are ready to attend the session and participate in speaking. I told you I will call you and you have to speak. So you are speaking. I'm already calling you according to the priority. So at the beginning of the session, when I asked you to submit your names and the professions, Avil Kenwith and Avil Kenwith a nurse. Sorry. Two students submitted their names. Two students dash Avil Kenwith and Kalai Chelvi Guruparan dash submitted their names. Colon means 2 dots. 2 dots. I'm teaching you how to write listing, how to speak listing. You'll get extra marks. 30 marks, 20 to 30 marks extra you can get if you make some listings like this. So, the former is a nurse, semicolon, and the latter is a doctor. two students submitted their names. Two students, Avil and Kalai dash submitted their names. The former is a nurse, semicolon. Before that is colon. Now semicolon. The latter is a doctor. Full stop. The complete sentence. Now same type. Can you use metformin and nifedipine for diabetes and hypertension? As a doctor, you are recommending these two medications. One is for diabetes, that is metformin. One is for hypertension, that is nifedipine. Can you make a sentence, Dr. Kalai? Can you speak it out? If you want to write first if you want to write first, write, no problem. Then you can speak it out. There is no problem. Instead of speaking out and making a mistake, better write and then speak. You can check, na?
Yes,
Yeah,
I
that
have
is
prescribed. I have prescribed metformin and nifedipine. The former is for diabetic.
colon, two dots, colon. Okay.
Yes.
Yeah, colon is
Former.
this one. 1 minute. 1 minute. This is the colon, and this is the semicolon or semicolon. So two medications will come this side. Former and later will come this side. Formide is this one. Later is this. Yeah. Continuation. Yes.
I have prescribed metformin and nifedipine. The former is for diabetic and the later is for hypertension.
The former is for a diabetic or a diabetes?
Diabetes.
Be careful. You made a mistake, correct?
Yes.
Yeah, that's what I'm saying. So I have prescribed two medicines. I have prescribed two medicines. Dash metformin and nifedipine, colon. I have prescribed two medications. Dash metformin and nifedipine. Okay. Are you sure of the spelling Nifidepine? Check in the dictionary. Nifidepine. Is it correct spelling? Check in the dictionary, please. Yeah. So metformin and nifedipine. Okay. Colon. The former for it is showing red line. That's why. The former for diabetes semicolon and the latter for hypertension. Yeah. I have prescribed two medications, metformin and nifedipine. Yeah, spelling mistake. Nifedipine. Medical dictionary. So it is Nifedipine. Okay. Yeah. NIFE DIPINA. Yeah. Nifedipine. NIFEDIPINA. Yeah. So spelling, Dr. Kalai, learn the spelling, right? 20 times. No problem. It's good for you. Next time you will not do mistakes. Na? That's why. Okay. No problem. Anybody in that case. So, yeah. I have prescribed two medications, metformin and nifedipine. The former for diabetes and the latter for hypertension. The same thing in another style using however. The former is for high diabetes, whereas the latter is for hypertension. This is another style, both the styles. So this is called quality. All of you can learn such sentences. They are very useful. I have some recommendations for you, Colin. I have some recommendations for you. Note down. I have some recommendations. I have some recommendations or lifestyle modifications. I have some recommendations. Colon. Alcohol consumption. Alcohol consumption should be minimized. And smoking should be ceased. So I have some recommendations. Alcohol consumption should be minimized and smoking should be ceased. Yeah, like this you can write some sentences. Right. So you are relating protest. Okay. But a nurse, when she speaks, she cannot say like this. The doctor has some recommendations, or the doctor has prescribed two medications. Like that. You have to change your style according to your profession. Right. Now, to complete the role play, what you have to do, you interact with an interlocutor. There is a dummy person, not dummy person, there is a dummy patient or a dummy caregiver. Not the real caregiver, not the real patient, but a dummy patient or a dummy caregiver, not a dummy person. Dummy person is different. Okay. He's a real person, but a dummy patient. There is no real patient here. There is somebody who is pretending to be a patient. So you are interacting with an interlocutor. He takes the role of a patient. He takes the role of a caregiver. So this person is not a real patient. This person is not the mother or the father or the friend of the patient. He is not or she is not a caregiver or a caretaker, whatever you call. But he or she is trained to be pretend like a doctor, sorry, like a patient. He's an expert in pretension. He does as if he is a real patient or a patient's relative. In some cases, he will take the role of a patient. In some cases, he'll take the role of a patient's relative, or in some places, he will take the role of a patient's caretaker or caregiver, a nurse or social worker or somebody. So, but on the other hand, you will be playing the role of a nurse or a doctor, a professional role. If you are a nurse, you'll pretend to be a nurse. If you are a doctor, you'll pretend to be a doctor. But not pretension here. You are a real doctor. You are a real nurse. There is the problem here. You are a real doctor or a real nurse. There is no pretension here. That's the fact. You are not just playing a role play, you are playing a real play. In that you should feel there is a danger here. In a role play, there is a danger. What is the danger? You are both a nurse and a student who is assessed. I mean the examinee. I mean a student, a language student, language student. So if you think that you are a language student, if you think that you are an examinee and the other person is examiner, if you think that you are a student and the other person is an interlocutor or a teacher or somebody who will give you mark or who is asking you questions, then there will be something called a fear factor. This will seep into your discussion. This will disrupt your role play. It will destroy you and it will trouble you. You should not think that you are a student who is going for an exam. You should not think that you are an examinee and doing an exam. What you are a nurse and you are talking to a patient. Don't think that he is an interlocutor. Don't think that he is an examiner. Don't think that he is an interviewer. Don't think that he is an English teacher. Don't think anything else. He is just a patient or a carer or a relative of the patient. If you think like this, you will be on the upper hand. You will have the upper hand because you are powerful. Who is powerful? Nurse or a patient? Nurse is powerful or patient is powerful? Come on, give response. I'm talking sense. According to your belief, who is powerful? Nurse is powerful or patient is powerful? Do you think? You are telling I'm bringing out the secrets for you. Many students they think speaking is very easy. I don't want to come. Very clever people, na? So nurse is powerful. I'm talking sense. Now, when a nurse is talking to a patient, Or when a nurse is pretending to be a patient, is not pretending to be a doctor or a examiner or is nothing. He's not a teacher. He's not a marks giver. He's not awarding marks. Okay. He's not assessing you. He's not an examiner. Now, if that is the case, if he is a patient and you are a nurse, you already told that you are nurse. Stronger one is the nurse. Now, if you are stronger, if the nurse is stronger, that means the patient is weaker. Who will listen to whom? Who has the subject of his problem? He knows only about his problem, but you know many things about his problem. You have seen many such cases, but he is not. He is the first time he is seeing this problem. Diabetes, first time diagnosed. Okay. So now, do you need to be afraid? You are a nurse. You have been a real knife. You have been a real nurse throughout your life. Nurse and life became knife. Huh? So, a nurse in a real life has encountered number of patients. In all these situations, were you afraid? In your vast experience of 10 to 15 years as a nurse or 3 years as a nurse, were you afraid to encounter a patient? If you are afraid, then it's a shame only. You cannot be afraid to a patient. How can you be afraid when you see a patient? Respond, I'm seeing only one is there. No. Hifza Jailani. Maybe Hifza Jailani is not wise. That's why she gave the answer. See? Avil came, he gave the answer. What about the others? You don't want to respond. I'm trying to build your confidence here, and you don't want to write 2 letters. So, you are not afraid. You're not in tension. You're not panic. Now, there is no need to be afraid because you have subject, you have knowledge, you have somewhat English. So why should you be worried? Why should you be upset? No need. Now get courage. Okay? Get that courage. You need not be afraid. When will you be afraid? When you think that you are a student and you are writing an exam and that exam will be awarded by him, then you will get afraid. Okay? So no need to be afraid here at all. Next. Now, I'm going to give you some points. The role play is like a real life scenario. They relate, they're parallel, real life scenario. In the real life of a hospital, in your hospital, in your real life, it's not artificial. This role play is artificial. This role play is artificial. But in your real life, as a nurse or a doctor, you have seen n number of numerous role plays and numerous patients. Real situations you were successful. Real situations you are not afraid. Then why are you afraid of this artificial situation? So imagine that it is a real situation and just enact. Next. Next point. You have faced a number of healthcare situations as a nurse in your hospital. You have seen diabetes patients. You have seen fractures, accidents, burns, injuries, bruises, and many other situations. You have witnessed many medical conditions. All these conditions you have handled very perfectly. The same thing you are going to do here. Only the thing is, this is an artificial setup where there is no real patient. A virtual patient is there. Okay. And he will pretend to be a patient from the beginning till the end. Next. You are expected to demonstrate a range of communication skills. Demonstrate, exhibit. You have to prove that you can communicate effectively using your communication skills. Now, the first point is the case notes or the role play card. When they give you, there is a lot of information. If you are referred or transferred, you have a case notes. Or discharged, you have a case notes. You have a referral letter or a discharge letter or a transfer letter. And you will have that information written in that one. This is not everything. This is only partial information. But the patient knows 100% of his condition. You may not know many things. So what you are supposed to do? What information you already know, you will share with him. And what information you do not know, you will ask from him. You will elicit from him. This is called as elicit. Point number 1, eliciting information or information gathering. Eliciting information. This is the first point. Eliciting information. Are we together? Am I teaching sense or nonsense? Do you think this is useful or not useful? Is this beneficial or is it a waste of your valuable time? Let me know, because it's already more than 1 hour that I have started and there are only 10 students now. Many students don't want to attend this session. They are wise. They don't need this information. So I think whether this information is useful for you or not. If it is useful, then we can go ahead. Otherwise, we can discontinue and we'll learn something new. If it is useful, what grade will you give for it? 0 to 100%. If it is everything is useful, if everything is useful, then type 100%. If the information provided to you is 50% useful, then write 50%. If it is a waste of time, nothing useful, then write a 0%. Just to judge whether my session is going the right way or not. Yeah. So that's it. So you require this one. So your words tell that it is useful. So let me continue. Right. The first one is called eliciting information. Eliciting information. Now, first point we are discussing. What is this eliciting information? You elicit information from the patient. So you are responsible for this. You are responsible for this. Why? Because you do not know a lot of information related to the problem. Okay? You do not know a lot of information about the patient's current condition. You do not know a lot of information about the patient's current condition. The person who has the best knowledge about his condition is the patient itself. There is a case notes. There is a case notes. Okay. And there is a referral letter or whatever it is. Now you know some information that is given to you there. And related information you do not know. So there is two types of information. There is two types of information. One is information you already know. Number one, information that you already know. This is number one. And there is information that you do not know and only the patient knows. Okay. Now, the information you already know and you will confirm with the patient. So you have to confirm the information with the patient. Okay. Are you Mr. John? Is your daughter perfectly all right? I came to know that she has wheezing and difficulty breathing. From here, the case notes. This is what you're confirming the information, confirming with the information so that he will not repeat the same things. So you have to 1A relate. This is you have to confirm with the patient. Okay. The information you already know. He should know that you already know this amount of information from the case notes or the referral letter. The next one, the patient should provide you the information you do not know because he is the only source. And you can get first-hand information. What do you mean by first-hand information? From the patient only. You can get first-hand information from the patient only. What do you mean by first-hand information? For example, Simon tells Peter, Okay. Avil did not do his homework yesterday. Simon said to Peter, Avil did not do his homework yesterday. Now Peter went and told Mr. Martin, Avil did not do his homework. He is very irresponsible. Now Martin will go and tell Mr. Richard, Avil did not do his homework yesterday. He is very careless. He is very lazy. This is what he does every time. He never does homework. So now you see how information is distorted. First hand information is the original information which is 100% truth, because the person who is experiencing is only talking. Now it then goes to the second person and third person and fourth person. The total information is distorted, and what you know, what you hear is something different. And now Mr. Martin goes and tells Mr. Nick, Avil is lazy fellow. Now you see the total different side. Something is told, and by the end of the day, something else has come out. The importance is here homework, and there the importance is laziness. Try to understand how words, when they pass on from one person to another person, they get twisted. So be careful. Trustworthy source is the first-hand information. That's it. The person who is originally facing these difficulties, first-hand information. Okay, don't trust when somebody says gossips. No, don't trust them. They are exaggerated. A person who is right, he will not talk behind others. That's it. And if you are a right person, don't ask second, third, fourth persons. Ask the patient first. Only if the person is not able to speak and express his knowledge or vision or understanding, if they are incapable, then only you can depend on wife or husband or other relatives. If you cannot get first-hand information, only in those cases you can rely on second-hand information, that also from trustworthy sources. The child cannot speak, so you should ask the mother. You understand? Okay. So that is the point. That is the next step you have to follow. The next one. So this information is given only by the patient. And next one, in order to ask these questions, eliciting information, you will ask some questions. You have to ask these questions. There are two types of questions you can ask. The first one is closed questions. Or the second one is open questions. Now, do you know what these closed questions or open questions are? If you know, you can raise your hand. Or if you know, you can type your name. What are closed questions and what are open questions? Can you please make a favor for me? Thank you. Take a new one. So, Kalai Chelvi. Very good. Yes, you can unmute and you can start your video. Yes, you can explain. Thank you very much for participation. Yes, your time is now on.
Closed questions mean when we ask, do you have fever? Patient tell yes or no. Open question mean we can ask, for example, can you please explain little bit more about your fever? Then patient will explain when it was started, how frequency, how severity is that.
Yeah, that's absolutely right. Thank you for your response. Now, coming to the question, yeah, it's absolutely right, but it is partial information. I'm giving you full information because I'm a teacher. So, now here, yes, no questions. So the label is called yes, no questions. Okay. Did you complete the homework? Yes, no. So there is nothing else to speak. There is nothing else to speak. It is a closed question. That means you are limited to speak either yes or no and nothing else. You have no third option like that. Okay. Do you like swimming? Yes, no. So if you say, do you like any sport? You will say yes or no. This is a closed question. The other way around, there are open questions. Can you please describe a sport which you like? And provide the reasons for your interest in the same. So this is called open question. Now here he will tell, actually, I do not like many sports. There are one or two items on my list. The first one is football, and the second one is cricket. I actively participate in football. Every week on Sundays, I go to the school playground or the village playground, and our friends also will reach there by 4 o'clock, and then we play for almost an hour and return to our homes. On the other hand, I like cricket also, but I cannot play cricket. You know, I was not trained for that one. But cricket, I watch on the television when the India match is telecasted. So this is called open questions. So ask open questions so that they can open up and tell. Now, eliciting information has one particular benefit. What is the benefit of open questions? If you ask closed questions, they will be rendered helpless and they will just open their mouth to say yes or no. That's it. They're helpless. They want to speak also, they will not speak. because you did not give him permission to speak. You have to limit, you are limiting his speech. Okay. There's a disadvantage for that. For open-ended questions, there is an advantage. What is that advantage? Can you tell me, please? Thank you. That is advantage for you. We can gather more information from patients. That is already it. Eliciting means that is the time. It's not time. It's not time because you have to speak more. What is the benefit for you other than you gathering information? Practical benefit. Anybody? What is the practical benefit? Candidate should speak. Actually, less time for the candidate to talk is a negative factor. You have to talk more. You have to talk more. Then only they can assess, na? If you talk 3 minutes and they talk 2 minutes, what will they assess? You have to talk more. You have to talk at least for 4 minutes. The practical benefit is you are befriending the patient. You are putting the patient into your pocket. You are making an agreement with the patient. You are sympathetic with the patient. By allowing time, by allowing some time to him, by allocating some time to him, you are making him involved in the speaking process, and he will be very happy to tell. Nobody will be interested to listen. Remember that. Everyone wants to speak. Every individual wants to speak, speak, speak. Nobody wants to listen in this world. Everyone wants to tell about his problems. Everyone wants to tell about his greatness. Everyone wants to speak only. Nobody wants to listen. So if you go on speaking, 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 the patient will be impatient. The doctor is not listening to me. The doctor is not bothered about my words. He doesn't allow me to speak only. So patient is not involved. So he may feel hurt. He may feel inferior. He may feel depressed. He may feel blocked. He feels that his right to speak is lost. He may feel helpless. He comes to tell about his problems. He wants to talk to you. He wants to tell you everything about his problems because he trusts that you are going to help him, and you are not allowing him to talk. That's the biggest problem. And second thing is, if you allow him to talk, you can understand the condition better because he's speaking in his own words. You can ask for clarifications. He says the pain starts here. Okay. Then you can ask him, and it goes where? To where? Does it stay stiff at one particular place, or does it radiate to some other locations? You can ask. Then he will tell very clearly, from here, it comes here, and it comes till here. doctor. And sometimes it reaches here also. So he's telling, demonstrating exactly from here, instead of telling from words. The pain is in the back. It begins in the back. Back means where? Which back? Here or here or here? It precisely points to the particular location. It gives 100% clarity to your doubts. You need not ask further questions. Like that he will explain. You will get 100% of the knowledge related to his condition. And based on this one, you can plan the future course of action. This is this information which is provided by the patient is the solid ground on which you can build up and work, move forward and explain. You can follow up from there. So give him a chance to speak. Don't steal his chances also. He wants to involve in the discussion process. He will not want to be a dumb fellow just listening with both the ears. He wants you to listen to his problems first. He has many things to tell you. But many people say, yeah, I know it is already there in the case notes I have read about. Okay, what you said, a part of it I know. But can you give me some information in your own words so that I can grade it as first-hand information? Okay. Open questions. You can use closed questions also. There is no problem in asking closed questions. Today morning, did you have breakfast? No, sir. No, ma'am. No, nurse. No, doctor. Then you'll ask open question. Can you explain me the reason for not having your breakfast? Then he will tell you everything. So like this. The next one, point number 2. Point number 2 is seeking clarification. Seeking clarification. What do you mean by seeking clarification? You have some doubts. Some questions or some queries. You do not have 100% information of the patient. In the case notes, it is written, vomiting, now here, you know that vomiting is there in the case notes. Now you can ask, when you ask him, you can ask him for clarification. You have vomiting sensation or have you already vomited? How many episodes? Thrice or 4 times? What is the gap between 2 individual episodes? Maybe once in the morning or once in the afternoon and one the next morning. Or within 2 hours of time, from 4 o'clock to 6 o'clock. You had how many episodes? 1 time or 2 times or 3 times? How long and how many times? What was the intensity of pain? Can you please rate it on the pain scale? 0 being the least, 5 being the average, and 10 being the worst pain. So this is the way how you can ask for clarification. Nurse, doctor, I have too much pain, doctor. What is the intensity of pain? You said too much pain. So above 5 out of 10. So what exactly can you give? 6 or 7 or 8 or 9 or 10? What is the intensity of pain? It is 9, doctor. It's unbearable. It's difficult. So this is called clarification. Next. Now, seeking clarification when the patient's statement is unclear. Seeking clarification when the patient's statement is unclear. The information is not very clear. He's telling vague. I have pain, doctor. How long is the pain? Or for how much duration did you endure the pain? And what is the severity or the intensity of pain? Is it mild or moderate or intense? How long was the pain? 1 hour or 2 hours or just for 5 minutes? And when did it subside? What did you do so that the pain subsides? Did you take medication? Or did you go for a sleep? Or did you relax and go for a walk? So this is clarification. Yeah. Next. Number 3. So you ask a question so that you get clarity of what his condition is. Number 3. Providing explanation. Providing explanation. You have to provide solid explanation. He will ask you, doctor, why am I getting this pain? Then you can say, right now, I cannot tell you why you are getting this pain. First and foremost, I want to examine you. We can go for a physical examination because I cannot judge superficially. So let me feel if there is a fracture or not. Physical examination. Sometimes like bruises, blisters, you can see physical examination. You can see and you can feel and you can touch using a gloves, using the gloves. Then if you get an idea, then you will provide information. I can see the tender mass. I can see the tender mass. And I can notice you just sudden movements when you felt pain. So it denotes that it is painful. So that is how you can say, providing information. Next, if that is not sufficient, then I may order some tests. You can go to the laboratory and you can undergo some tests. Blood test, urine test, and what all you want to write, you can write. Only after that, I can get a clear picture of your problem if it's a doctor. If you're a nurse, now the doctor will arrive in 15 minutes and you can share all your problems with the doctor, and then the doctor will tell, or nurse will tell. So I will arrange a meeting with the doctor. The doctor will examine you physically. Then he will order some tests. So you're talking like a nurse now. And you will get the reports within 3 hours. And the doctor will study the X-ray against light. And he will try to diagnose the problem. And he will provide the relevant information why you are facing this problem. So providing information regarding the present condition, regarding the investigations, regarding the examination, regarding the diagnosis, regarding the treatment, everything. And here you have to use the information, you have to use the language style so that the patient can understand. He needs the patients to understand. Right. So providing information, and the information that you provide should be understandable. Even a layman should be able to understand. In that way, you have to speak. There are some people who, when they speak, nothing is understood. They speak very fast. No, that's not right. You have to speak in such a way that the patients can understand. Because this is called target language. Target language. Next one. Fourth one. Offering reassurance. Offering reassurance. Now, what is this offering reassurance? Doctor, nurse, I am not able to bear this pain, doctor. I don't know how I am going to manage. I am afraid of taking insulin injections. Never in my lifetime I have taken injections on my own. This is the first time I come to know that people can inject on their own. Can you please help me, doctor? I'm little bit scared and worried and upset. I don't know how to manage this situation, doctor. Can you please help me? Then you will provide reassurance. You are absolutely right, Mr. Lincoln. Your reasons are partially correct. But that is one side of the story. You're right. Mr. Newton, whatever you are speaking sounds very excellent. But the thing is, there are many patients who have diabetes, and out of them, 5% of the people, it becomes serious. For those people, self-injecting insulin will be recommended. I'm little bit clear, I suppose. Some people are those who are not able to manage blood sugar levels will be recommended to take insulin injections. In my 15 years of service as a nurse, I have seen many patients being recommended insulin injections. Initially, everyone will be afraid or in panic. Slowly and steadily, they understood the importance. After counseling and education regarding insulin injections, they understood the importance of these injections. They will realize that there is no other possible option. And the last but not the least important option is dash. So this is the way how you are going to speak. One of my cousin also has a diabetes. I taught her how to take insulin injections. And then now he is leading a normal life. The only difference is he is taking insulin injections. One time only. So this is the way. They are able to manage their condition effectively. But for the first week or 5 days, I'll be coming and monitoring you how you are taking insulin injection. After that, you can go on by yourself. If so many people are able to manage their lifestyle, they are able to manage their condition, then why can you not manage equally? If you are compliant with insulin injections on a daily basis regularly, then there are chances the condition can revert to normal, return to normal. And then you can stop taking insulin injections and be on medications again. So this is the way how you will reassure. If I were in your place, different types I have given you, number of sentences, 3, 4 together I gave you. You get take whichever is the best and you can use it. Then next, offering reassurance. In this offering reassurance, you will give the patient comfort and you will give the patient warmth. Warmth. You are not cold to him. There are some doctors who say, I have pain here. I know in this, I know everything. You don't worry, I will give you med. Why are you not allowing him to talk? That means you are cold to, you are giving a cold treatment. You are cold to him, you are not warm. That means your relationship is not very strong. You are damaging your relationship. So that warmth, he should feel. Okay. The next one. So the patient is anxious or agitated or worrying. Patient. You are giving him a feeling of comfort and happiness and warmth and all. The next. Providing advice. Fifth one. Providing advice. Providing advice. So you are going to advise him many things. Based on this discussion, based on the points that we have discussed, according to our meeting, after considering our meeting seriously, after analyzing your difficult situations, like that you can say. So providing advice. I'm going to give you some recommendations or some suggestions or some advice. Firstly, lifestyle modification is of utmost importance. Minimizing alcohol consumption, comma, minimizing alcohol consumption, comma, and smoking cessation are extremely important, are recommended, are advised, are suggested. The next. So advice regarding what? Advice regarding what? You are going to give advice regarding what? Regarding lifestyle. You can suggest some recommend modifications. His lifestyle is not proper, so suggest modifications. Next, number 2. Okay. Health promotion, enhancement of the physical condition. You can give advice. Stay away from sunlight, like that. Next. So regular monitoring. So you have to give advice or education, regular monitoring, and you have to give ongoing management. So how can she manage the condition? Ongoing management. And preventing risks. Preventing risks or eliminating risk factor, you can say. And all these are relevant. All these are relevant all these are relevant to the patient's circumstances. Relevant to the patient's circumstances. Relevant to the patient's circumstances. You have to give advice. See, you have a small child. Cessation of smoking is recommended. Avoid smoking in the office premises. Cessation. Continuation of medication is advised. Next, adapting speech patterns. Next one is, seventh one is adapting speech patterns. Adapting speech patterns. When you are talking to a small child, okay, how you talk is not the same way as you talk to an old man of 60 years of age, nor to a man who is 40 years of age. So every age has some idea. They may differ from person to person, place to place, time to time, and situation to situation. It cannot be one and the same always. So you have adapting. For example, if it is a lady, your approach will be different. If it is gentle, approach will be different. For example, if you if you are upset waiting for a half an hour and you see a male nurse, you will be shouting at him. But this one is not in the similar way. Yes. So try to understand these measures. I have given you 7 specific measures. Okay. When you are interacting with patients of different age groups or different patient types, plan accordingly. That is what I recommended. Sometimes patients are adamant, reluctant, different types of patients. So you have to adapt according to. So this is the first episode for speaking. Then we'll come later with the second episode of speaking. So provide your feedback. Provide your valuable feedback for this session. Provide your valuable feedback for this session. Don't just write one word or two words. Give what you benefited and how it was useful for you. I'm giving you 1 minute so that you can write. Yeah. Riya Kadarkattu. Kadarkutti. Riya. Where is this? Riya, can you unmute? Is this iPhone Riya's? Unmute, please, Riya. Or is this Shabnam? Yes, sir. Riya, I cannot hear you, Riya. Can you speak?
Yes, sir.
Yeah. Are you comfortable to come on the video?
Yes, sir. 1 minute.
Yeah, no, it's okay. Because you know you are sharing your opinion. Everyone will be happy.
Yes.
I know you are very obedient. That's why I'm asking you. Yes, please. You can share your experience. What is the gain you got? And yes, you can. You have 1 minute. You can unmute your phone 1 minute. Yeah, you can unmute.
Sir, this class is very useful for me. Um, for
Yeah, this
me,
is
the speaking session is very difficult. Actually, I don't know these many steps have during the speaking section. Today only I realized that is many step we have, and what and all points we have to notice when we are doing the speaking session. Not audible, sir.
Sorry. What are the points that you have learned today? Any new points? 1 or 2 you can speak.
Like how we are starting a conversation, and what and all including in that section.
Yeah, that's very good. Thank you very much.
Like
And
how
now,
we are
continue.
We should comfort the patient first, and how we are approaching, and what and all points, like what and all points we should ask them, like their lifestyle, and like that.
Yeah, very good. Thank you very much for your feedback. And I'll ask 2 more people. There is an exam going student, Muttu Lakshmi. Muttu Lakshmi. Yes, Muttu
Yes, sir.
Lakshmi.
Good evening, sir. And
Good evening. Can you start your video? I think you are comfortable. So you can open your video and you can share your experience. Yeah.
yes, sir.
Yeah. Can
Sir,
you share
thanks
your
for having me.
experience?
Yes, sir. Thank you for your session, what you have provided today. It is absolutely a structural format of speaking presentation, and it is very useful for us. And if we apply, definitely we can achieve the higher score. And the step by step of convince the patient, and the time period what we are giving to allow the patient to express their feelings and concerns. It's totally by your teaching. Actually, I have learned a lot of things. We have learned even a tiny points you have noticed, and the importance of communication and the way of presentation. Everything you have um, gave a meticulous information for us. So thank you so much for this session, sir.
Yeah, thank you once again. Next, we'll take one doctor here. Kalai, only doctor is there, Kalai Chelvi. Yes, Kalai Chelvi from Sri Lanka. Yes. Yeah, very good. Yeah, now you have your voice. You can share your experience, how these sessions are benefiting, and what, especially as a doctor, okay, it's very difficult for you to find a tutor. Okay, you with great difficulty you came and you joined and you started. 2 times you faced problem, and now nurses means many people they will get because they learn from nurses, but doctors it's not so. Doctors cannot learn from nurses, so they won't even learn. So it's a very serious problem to find a trainer for doctors. Very few are there, and that's really tough job. But after coming here to our platform, what is the benefit that you gain, and what is the today's session? Is there, you already passed in writing, I know that, sorry, speaking, but still, what you gained in today's session, what made the difference? What is the difference? Yeah.
Yes, but I just passed, I just got 380 and 340. So the main information today I got to know is the steps, because when we starting the, when I did the exam without planning, so today only I know about the steps, whether for example, clarification and explanation, how to give the sympathies, and how we can ask from the patient, and what is the importance of patient to give the time. Those things are very informative to me, and I hope when we are doing the exams, we have to make it more valuable, more sense. Then only we can score marks with the correct grammar. So it's very informative, because today only even though I am doing several practices, that I got to know about the steps, the importance of planning. That's a very important. Maybe during the 3 minutes we can plan according to the steps. So that will be the more palatable and more valuable speech session, I think. I hope.
Okay. Right. That's very nice. And one last candidate. Yes, Sajida Tabassum from Kuwait. Sajida Tabassum. Sajida Tabassum. Yeah, Sajida. If you're comfortable, you can switch on your video and you can share your experience. Yeah. Thank you very much.
Thank you, sir. Thank you, Sach, to give me a chance to speak in this platform. So today class was very wonderful, very tremendous explanation. We learned how to gather the information, especially warm-up session, how it benefit for us. And other thing is that how the valuable open-ended question for and how we can proceed the information with patient, and which way we can also involve the patient during the conversation, and how we give the chance to speak up our patient regarding their problem. And other thing is how to gather the information from the patient, which question, how we can ask the question from patient that they will open his and herself to front of us, and it will helpful because sometime we have some reluctant patient and they don't want to speak, and how you told us the strategies how will involve this kind of reluctant patient in our role play.
Yeah. So Sajida Tabassum is originally from Pakistan and she's currently in the Middle East. Right. So that's all for today. So I can call everyone and ask, but Simon sir is tired and he has to go for dinner, and that is for now. And if Simon sir is fine after dinner, now it is 10 o'clock. Okay, we can start another session and it will go for 3 hours. Another session, it will go for 3 hours. How many of you are interested? How are you in? Are you in? If you are in, type in, or are you out, type out. This should be in one skill. If you say at least some 6 students, 7 students say in, then I will discuss what topic. You have to decide what topic. Now, Avil, can you count and say how many ins are there and how many outs are there? I need at least 7 in to start a session. And anyhow, we have seen these sentences, these styles here. Now we'll see some sentences, how the sentences can be used. Do you want to continue speaking, or how many number? All how many? 7 or 8 or 8 ins. Okay, fine. 8 ins. Okay, that's right. I am also in. I am all sorry. I wrote. Okay, in. Sorry, in. So I am also in. Right. So what shall we say? Continue speaking. Number 1. A is continue speaking. A is continue speaking. B, shift to writing. C, listening. D, reading. Now you select your choice. All of you give your voting again. A, B, C, D. A, B, C, D. So which is the majority? How many A's? Ifat, how many A's type? Then Kalai Chelvi, how many B's? Count and write. Avil, count and write C. Sajida, count and type D. 1A. What about B? B is 3, D1. Okay, so B is what? Shifting to writing. Yeah. So we'll be doing writing sentences. These sentences will be for both. Some quality sentences I'll give you. Writing sentences. This will be for writing as well as speaking. Both they will be useful. Writing sentences, letter, and for speaking also they will be useful. So both. So now do you want me to write A? I'll take which type of letter? Referral letter, or B, discharge letter, or C, transfer letter. Okay. Any one of the three. So right. So now it is 21:56. So we'll meet at 22:30. 30 minutes. After the break, I'll send you a new link. You can join. This session will be for 3 hours. This session will be for 3 hours. And this session is only for regular students. Okay, have a nice day. See you again. Bye.